on Facebook. So hello Facebook. We are back again for our 7:30 health edition. The front lines of COVID-19. We're gonna have somebody come on that's actually boots on the ground in the trenches with this epidemic that we're dealing with at the current moment. So she will be calling in momentarily. And if you all could just let me know that you can hear me and hear her, okay, I would greatly appreciate it. Do we have Liz on the line yet? Wonderful. Good morning. Good morning. All right, so we won't delay. We're just gonna go ahead and jump in. Liz, Elizabeth Harden. She is a PCT, literally on the front lines of this COVID-19 pandemic now. And you are a PCT at Emory University Hospital and at Grady Memorial Hospital, which are two very prominent hospitals here in Atlanta. So just in the healthcare field, period, across the nation. I'm sure that there are a lot of things that we're not seeing, that we're not hearing necessarily in the media. You shared some very insightful things with me on yesterday. So I'm just going to give you the floor. And if you can just kind of share some of those things that we are dealing with, that you all are dealing with, really, on the front lines that you shared with me yesterday, that was very insightful.
Um, our stress level is very high. Um, we're dealing with short staff right now, and we're working around the clock at all the hospitals. And a lot of things that people need to know, of course, is to wash their hands and to stop having the gathering. Because one thing at Grady, when you walk in at Grady, you're going to get swabbed. The public going to get swabbed. As far as staff, we get swabbed immediately if we get sick. But what I find fascinating is we have a test where I was sharing with you that can determine us at 90% infection. As far as staff, we get swabbed.
Wait, I'm sorry. Say that one more time about that test.
We get swabbed like we just can't know right away for us as healthcare providers. So pretty much so we can go back to work and make sure that we're not sick and carrying the virus to the next level.
So just a quick question. I'm sorry. So you all's tests come back in 90. You said 96 seconds. How long is it taking for the people that they're swabbing before coming in? How long are their test results?
um, on Sunday.
Wow. Wow, that's a major difference. Huh. Okay. Go on.
I'm sorry.
No, I was saying go on. I just wanted to clarify and make sure I was clear on that on those testing results.
And uh, say that, we have these supplies when in actuality we don't. We're getting better at getting some in, but it's just not coming in fast. Um, so, you know, as far as like our N95 mask, what we're doing right now is we're the N95 mask, so we also put surgical mask on top of that N95 mask to preserve it. Because technically you're supposed to throw your N95 mask away, but with that we have shortage of supplies, we can't do that. Um, we strip down to our clothes. We wear clothes additional clothes rather to work. So we won't carry, because now what we have what is called huddles, during the shift, as well as anything that changed in the middle of shift. And basically what they tell us is make sure that you take your shoes off, you take your uniform off, before you get in your car, so you won't carry this forward to your home and to your family members. So,
Wow.
yeah, that's pretty much our dilemma at this present time. And another thing I wanted to add, as I was sharing to you in conversation, that as healthcare provider, not only are we having, you know, with this virus and we're working, trying to get people back healthy, but we're also being attacked. Like if we wear our uniforms outside of the hospital, like if we try to go to the grocery store, or gas station, people now my manager is telling us don't wear our uniform outside of the hospital because people are attacking us, thinking
Wow.
that we have supplies. We don't. We don't carry supplies in our cars. um, we just doing enough trying to have supplies that work. So
Wow.
right now we just kind of doing it just like the public, but our stress level is is very high.
Yeah.
The fear level is there. However, we don't go to work in fear. We just go to work trying to do the best that we can do and focus on the task at hand and keep it moving.
Wow. That's I can't imagine you leaving work. Like say for instance, if you're in your uniform and then you have the threat, a high threat of you being attacked in a parking lot because they think that you have supplies like on you or in your car.
Yeah. Not even thinking from before you came home, and it was like just the dirty looks you get, and it's just crazy, and people are scared.
Yeah.
People, I see people with gloves on, and just let me bring this to people's attention as well as far as gloves is concerned.
Hmm.
I understand that people are very time to get that, but if you do not change your gloves, I see people out in the store. As a matter of fact, I was in the store yesterday at Kroger, and I see this woman with gloves on, but you're still contaminating yourself. You're still contaminating your loved ones if you do not change your gloves. Just because you're wearing gloves, it does not prevent anything. You have to take those gloves off. Let's say, for example, let's say you walk in the Kroger with the gloves on, but when you walk out, or when you leave, you need to change your gloves constantly because gloves are contamination. So, yeah, we change gloves constantly, and people thinking, "Oh, I have my mask on, I have my gloves on," but it's so much more and so much bigger than that because it's still spreading. The spread is on everything, and
Hmm.
the fact that you cannot actually see, um, they call it the invisible death right now. You
Yeah.
don't know what you know. Uh, that love not
Wow.
so
Yeah, so you gotta because you're probably cross contaminating. Am I right? If you have on the gloves, you use them in the grocery store, and then you go to another store and you use them, and then well, even if you throw them away when you get home, you've touched your doorknob at this point. You've touched your lock at
right.
this point. You probably have touched something in your house before even really realizing it. Um. So
Now what
no, 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 go on.
now, but the media is not speaking of. Yes, it is attacking respiratory patients very badly. If people or if you have a low immune system, or if you know people that are older, you know, this virus at this present time, it does not show no favor to no respect of person.
Hmm.
Um, However, okay, now, people are not,
Really?
you know, they had it, and um, we could we would know a little bit due to the fact that we would automatically be like, okay, when you're coming in and you're not breathing or having difficulty breathing, then they'll automatically screen you. And they still do, but the fact that younger people, they're not having any symptoms. So only thing that one of our number one thing is those factors is respiratory. And if you have a fever and your fever spikes to 100, that's when they try to get you in there. But at this present time at Grady, we are up to capacity. We are up to capacity with beds, and like you said, I work at Grady and I also work at Emory. And at the location I'm at Emory Cab, we have floors that have nothing but COVID-19 patients.
Like, so y'all have whole floors with nothing but positive diagnosed COVID patients?
Yes.
Wow.
Now, or COVID patient, or they haven't called PUI. PUI is supposed to that it's patient under investigation. That's what PUI.
Patient under investigation? That almost sounds criminal.
It does sound criminal, but you have to put it in a different code because everything for those that work in medical coding, there's a way that we have to. There's the way that they screen the patient. Okay. So when you have a patient, for example, that label as PUI, then we're definitely that much focused on, okay, let's immediately get this patient screened. Let's see what we can do. We definitely have to keep an eye. And as a patient, as my job as a patient care tech, of course, I'm in that patient room. The nurse's role is administrate the meds. Mm-hmm. My role is everything itself, administrating the meds. So therefore, I'm with a patient. Let's say if I have a patient that's a PUI, which I did have a patient that was a PUI, and I'm in and out of the room. Right. But when their tests finally come back, and I pray to God that their test be negative. So sometimes we have a patient that tests come back positive, and then the floor that I work on is reading. Yeah, we have to bring the patient the isolation. And unfortunately, we have a whole hallway full of patients. We've had patients down in the emergency room for 4 or 5 days that are PUI, and that turned out to be COVID. And then there's another problem. What people don't see is once that patient down in the emergency room that's 4 or 5 days, but they're PUI status, and then they turn from PUI to positive. Now you have another problem because you've gotten other people contaminated. So because of their coughing, and then unfortunately, as I was talking to you about, one of our biggest things is with the homeless. Of course, they're not coming in and getting tested, and when they do, they so worse than and it's not just their just the COVID that we're dealing with. There are other underlying health issues that we have to deal with. So, yeah. A lot of us, we don't. I have a couple of weeks myself, I'm working. By the time I do get sleep, it's time for me to go back to work because our 12-hour shift is now sometimes turned into 16-hour shift. Wow. Our doctors turn into 12-hour shift. We're really working off of sleep deprivation and coffee or whatever keeping us woke. Wow. Unfortunately, But we had one night where we hear nothing but codes going off all night, and those are code blue.
Huh.
Just imagine working in a field where you're hearing the code blue going off 6, 7 times throughout the night,
Wow.
and that's a lot. So, and unfortunately, they keep telling us it's going to get worse before it gets better.
Yeah.
Uh, I understand that people are getting cabin fever. I understand kids maybe getting on your nerves, like your spouse, significant other, maybe getting on your nerves, but it is vital that we do what is being told to do. Is stay in the house, be your social distance. And I constantly see people, I see gatherings, I see people going out and still have not taken this serious. But this is a very real and very vital threat to our society right now.
And if anybody can speak to that, I mean, it would definitely be you. And I thank you for that, because I mean, unless you're in the shoes of the healthcare worker, or unless you're in the shoes of that patient that possibly have been diagnosed, I think it's kind of hard to really understand what's happening until it happens to you, or until you have that
Right.
family member unfortunately that is affected by this virus. And as of lately, what I will say is, and I thank you so much for sharing this information. But lately, I've been having, like, getting text messages and phone calls, and these are people that I know that have family members that have, unfortunately, have been diagnosed, gotten positive results, and a lot of their cases have been handled so differently. They've been sent home until excuse me, until their results come in, or they've been sent home until they say the doctor for them to call them, and they're dying at home before they even get their results. And so there's a ripple effect, because now it's my understanding that even the mortuary um business, I mean, they're being affected when they have the bodies come in. So it's definitely something very serious that we're facing and we're dealing with. I thank you so much for your insight and just being on the front line. And really, it's truly, you're risking your life, like, every day that you walk into that hospital. You're risking your life, not only because of somebody being sick, but desperate family members um, that want to see their family members healed. Uh, Desperate patients that want results, and want to be better. So I thank you so much for everything that you're doing. I thank you for sharing your knowledge. And again, I thank you for everything that you're doing. I know that you just got off work, actually, so I'm not going to cut into your sleep time any further. But I just really want to thank you for that insight and for that information.
Coworkers, all the healthcare providers. Everybody wants to be loved one, but because I had someone mention that they think it's unfair and they want it to be lawsuits of they can't see their loved ones. People need to understand we're not trying to keep their loved ones out the hospital, but all hospitals are locked down. And that's for the protection of your loved ones and protection of us as well.
Yeah.
And like you just said, the boards are getting outstanding. Like, we're working with dead bodies. What I mean by that is that there is no place to put bodies. Um, you know, we were just looking at, even in New York, you have trucks, cooler trucks, 18 coolers, with nothing but dead bodies inside. Therefore, because there is no place to put these bodies. So, we have to, and we're going to do it, our CEO, at all the hospitals, And yet, it's very hard. Not only, the operators are overwhelmed for loved ones calling and check on their family members,
Yeah.
but also when there's so much information over the phone.
Yeah.
So, only thing so that don't want to have their field, because one thing that I love that we're doing is we all say a prayer before our shift starts. We all have huddles sometimes and we pray because it is very difficult at times
Mm-hmm.
to have patience at times. Their loved one can't see, their loved one can't pull their hand in their transition, or listening to someone on the phone cry, and it's just at the same time, you know, sometimes we go to the bathroom, we shed our tears, and then we have to wipe our faces and get back out there again. So it's not that we're trying to be insensitive; it's that we don't have the time to. We got to keep it rolling, and it will get better. I
Yeah.
can't tell nobody when it will be, but just hang in there and keep prayers coming
Yeah.
for the world.
Definitely.
Because we are right now. We are all in this together.
Yeah.
You know, only God knows and He's gonna listen.
Yeah. That's right. That's right. He definitely is. He definitely is. Um, it's heartbreaking all around, and that's why we have to. I mean, as you were sharing that, especially with the coolers of unfortunately people that have transitioned. Man, tractor trailer trucks, refrigerated, full of bodies and families, that can't even really properly mourn their deceased family members. It just reminds me this is why we have to cast our cares on him, because we don't have the strength or the power to do it. It's way too much. It's too big of a burden to carry. And that's why we are truly in this together. So thank you so much again. I appreciate everything that you're doing, everything that the healthcare field is doing. I'm gonna go ahead and let you go, but again, I just want to tell you thank you for that information, and thank you for just being on the front lines. I mean, these are things that we couldn't possibly know, unless we were in there. But one thing I do want to know, what I do want to share, is that you share this information so we'll know how to go deeper in prayer for you all, and not just for you all, just for those people that are impacted. It's a ripple effect, and we are in this together. And when I mean we can't go, we can only do what we can do. And I know that prayer is powerful. I know prayer can intercede, and that's what we'll do. So thank you so much again for your insight. I greatly appreciate it. I'm very, very honored to know you personally, and I thank you for everything that you bring to the table and everything that you do. All right. Love you. Have a wonderful day. Bye bye. So, as she mentioned, um, the best thing that you can do right now is to cooperate. And just like she said, stay home. Try to minimize your gatherings around people and things of that nature. And certainly, if if nothing else, if nothing else, please be in prayer. If there's nothing else that you can do, for be in prayer for our healthcare workers, our school districts. Everybody is just in uncharted waters right now. This is new territory for everybody. So I love you all. You all be safe. Praying for you, praying for families, praying for healthcare workers, just really extending prayer all across the board. So I love you all. You all take care and you be blessed. All right. Thank you for tuning in.